Okay, so there are common abbreviations that are used, when you want to administer drugs, when you want to come in contact with a patient, when you want to do anything that concerns your nursing profession as a nurse. There are some common abbreviations that you should know and you should be conversant with, because they are really going to help you, in the sense that when you are about to, when you come across these abbreviations, you know what they mean. Even in your sleep, when you are waking up from sleep and you are asked what does this abbreviation mean, you are able to answer them correctly. So you'll be coming across them during the course of your profession as a nursing student, as a nursing student. You might come across them during exams, during your clinical training, your clinical posting, and as a nurse you would come across them while on the job, whatever you are doing that concerns nursing. So these are very common abbreviations that you need to know as a nurse. That is what I'll be sharing on this video. So if you are a new subscriber, welcome to this channel. This is Nursing with Annie. You are very welcome. On this channel, I think about nursing, health, lifestyle, educative content, entertaining content that is going to benefit you. And yeah, that's what I film. If you're a returning subscriber, thank you for coming back to see what this video looks like. I am very grateful, and thank you for sticking with me. So on this channel, on this video, I'll be sharing with you some common abbreviations that are used in nursing. So if this is a video you're interested in, do well to sit back, relax, and enjoy. First off, I'll start with the very common ones that has to do with vital signs. So you have VS, which is vital signs. We all know what vital signs means. They are the basic indicator, that tells you what goes on in a human being without you cutting off the person, without you opening up the person. So the first is vital signs, VS. So wherever you see VS, just know that what it means is vital signs. Then you have TPR. This is temperature, pulse, respiration. Normally you will see this during OSCE, during vital signs. Most especially you will see where they will say carry out a procedure, on TPR. You already know it's temperature, pressure, and respiration. Then you have BID. This is when it comes to drug. This is 2 times daily. Whenever you see a prescription that carries BID, it means you have to give that drug 2 times daily. Then you also have TID. It means 3 times daily. So whenever you see a prescription that carries TID, it means you have to give that prescription 3 times daily. Then we have NPO, which is new per oral. New per oral simply means you are not to give this patient anything by mouth. You are not to give this patient both fluid, both food by mouth. You normally see it pre-surgery, before a patient goes for surgery, during the doctor's write-up or reports. You are going to see patient should be on new per oral, meaning this patient should not be giving anything through the mouth. Then you have IV, which is intravenous. This is a means of taking in drugs through the veins. So that is what IV is. You also have MEDS, that is meds. Meds simply means medication, drugs. So wherever you see meds, you already know that they are talking about medication. Then INJ, which is injections, is a short abbreviation for injections. So wherever you see INJ, you know that they are talking about injections. Then you have NS, which is normal saline. Normal saline is intravenous fluid that are given to patients. So wherever you come across NS, you already know it's normal saline. Then we have DS. DS is dextrose. So we have DW, which is dextrose water. So wherever you see DW, you already know that what they mean is dextrose water. You see during drug prescription, you are asked to give a patient DS, and then you see the amount to give. You already know that DW, sorry, I don't know why I keep saying DS. DW is dextrose water. Then you have TAB. TAB simply means tablet. So whenever you see TAB, it means tablet. Then you have GTT. GTT simply means a short abbreviation for drops. So wherever you see GTT per minute, it means drop per minute. Yeah. You have AM, PM. This has to do with time. AM is in the morning, PM is at night. Then you also have CBC, which is complete blood count. So you can see this during test result. When a patient comes with his test result, or a patient is asked to carry out a test and you see CBC, it means complete blood count. You also have WBC, which is white blood count, RBC, which is red blood count, So yeah, O2 simply means oxygen. You are supposed to be familiar with that. O2 means oxygen. H2O means water. H2O means water. NEG means negative, negative, or you see the plus or minus sign, it's negative or positive. Then there is LMP, last menstrual period. There is EDD, expected date of delivery. This one has to do with obs and gynae. Like I said, LMP, last menstrual period. EDD, expected date of delivery. We also have C/O, that is complaints of or complaints. C/O, complaints of. And there is pre-op, post-op. Pre-op is before operation, post-op is after operation. We also have PRN, which is when necessary. It has to do with drug calculation, pharmacology. When you see PRN, it means when necessary. Also, when you see start, it means immediately, especially when it comes to drugs. If you see where a drug is being administered and start comes before the drug, it means you should start that drug immediately. That is what it means. So I've said PRN when necessary, start immediately. Then also we have DRSG, which is dressing. When it comes to wound dressing or any kind of dressing, if you see DRSG, it means dressing. AM, like I said, is morning. ABD means abdomen, that is the abdomen. Then AMB means ambulatory. AMB means ambulatory. DC means discontinue. It could be a drug, it could be a prescription or a medication. DX means diagnosis. DS means diagnosis, yes. ABO is the blood group system. Wherever you see ABO, it means it has to do with the blood group system. We also have QID, which is 4 times daily. I mentioned BID, TID, QID. So this has to do with the number of times you give a medication. QID is 4 times daily, BID is 2 times daily, TID is 3 times daily. So this is the difference. Those words in food, they are actually Latin words. I cannot really remember the Latin words as it is, but they are Latin words. But in English, they mean 2 times daily, 3 times daily, 4 times daily. And W is weight. So wherever you see W, it means weight. Wherever you see FG, it means milligram. Wherever you see G, it means gram. Wherever you see kg, it means kilogram. Wherever you see G, okay, I said it already, it means gram. There are so many of them which I cannot really remember all now. I think we also have, okay, I've mentioned start, which is immediately. Then we have PRN, that is when necessary. When necessary, it has to do with drugs too. When necessary. Like I said, DC is discontinue, and that's basically the ones I can remember right now. We have PC, which is paracetamol. That one is popular. We have I/O, which is input and output. When it comes to fluid administration, the amount you've given and the amount the person has actually produced. So the thing is, there are so many of them, and you can look them up in your textbooks. You can look them up online. These are basically the ones I can remember as at the time I'm filming this video. So I said, okay, let me just come and film this video and give out this information. There are so many online. All you need to do is go online, look for them, open your textbooks, read. Knowledge is vast. There are so many things to learn. There are so many things to know. The thing is, are you ready to learn? Are you willing to know? So yeah, I think I've exhausted my point in this video. If you want to know more, if you want to learn more, you can go online, check your Google, check the internet, open your textbooks. You're going to see them. And yeah, I've come to the end of this video. If you stayed with me on this video till now, thank you very much, and God bless you. If you're not subscribed, please subscribe. If you like this video, if it was helpful, give it a thumbs up, give it a like, share, comment, drop your comment. I am looking forward to read your comment. I'm looking forward to your comment. So please drop a comment, share this video to your loved ones, friends, families, you know, that your nurse friend, your nurse anyone that is related to you that's a nurse. Please share it to the person, and I'll see you in my next video. Thank you. Until then, bye.